Are you a military veteran looking to file or to improve a disability claim from an injury or condition you developed during your training or service? I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help athletes and active people, as well as current and former members of the U.S. Armed Forces, feel and perform their best regardless of age or injuries. I know you're frustrated. You've hurt for years after your time in military service, and the VA system's making it hard for you to get the compensation for that injury now. Maybe they think you're faking your injury or exaggerating your pain or just milking the system to get money. I know you'd much rather not hurt and just be able to do your job or do your normal daily activities without pain rather than get a check for that injury. But that money could help you see a doctor or an orthopedic surgeon who can actually treat your pain and help you overcome the injuries. It might help you pay the bills for you and your family since your injury makes doing what you need to do at work really difficult. Maybe you've asked your doctor or your orthopedic surgeon, whether that's a doctor at the VA or one outside the VA system, to write a Nexus letter on your behalf, but he or she wouldn't do that for you. I hear all the time from veterans how their doctors say they can't or won't do it. Maybe it's a conflict of interest. Maybe they're too busy, or it could be any other number of excuses. You're frustrated by the months or even years you've waited on the VA system to deal with your claim. You're angry because you feel like they're giving you the runaround, making you want to give up. You're frustrated by the VA telling you that your pain or your injury isn't service connected because you didn't seek medical attention while you were in the military. But I know how hard it is going to the doctors when your leaders make you feel like you're weak or they're pressuring you to just push through it. You need an orthopedic surgeon who can argue that military service members often don't report injuries due to the potentially negative ramifications those injuries may have on your career. You need an orthopedic surgeon who can argue that exaggeration of injury and pain is extremely rare among service members and veterans. Maybe you've already filed a disability claim and you were denied for your injury. Maybe you tried to complete it without an expert's Nexus letter, or you got one from a PA or chiropractor or nurse practitioner and were denied. You're angry the VA's rater doesn't believe your pain was caused by your duties in the military. You'd benefit from the expertise, the experience of someone who actually treats injuries like yours, an orthopedic surgeon, one who has 3 board certifications to argue on your behalf that your injury should be service connected, an orthopedic surgeon who understands the physical demands and stresses the military activities placed on your body and how those turn into injuries or degenerative conditions. An orthopedic surgeon who understands and who can argue how one injury can cause a secondary injury in a joint above or below the first injury or on the other side of the body. An orthopedic surgeon who can review your records, your duties in the military, and more to create a persuasive letter created just for you to give you the best shot at winning your claim. I'll be your champion, your guide and trusted advisor through this process to help you get the medical advice and compensation you deserve as a military veteran. If you need a Nexus letter or DBQ as part of your disability claim, I'd like to help. I know how physically demanding military training and service can be and the injuries that can result. I want to share my knowledge and expertise to help you with your ratings by arguing that your condition is connected to your service. Why should you go with me? In my experience, most private physicians who treat veterans don't have the time or the desire to go the extra step of writing comprehensive Nexus letters for their patients. There are also a number of other healthcare providers out there willing to help veterans with these Nexus letters, but most of them are not physicians. They're nurse practitioners or chiropractors. Not that there's anything wrong with those providers. I love working with them and think they can be very helpful in our healthcare system today. But with Nexus letters, when you work with me, you have someone on your side who treats these injuries in his practice and who's performed these surgeries countless times. Also, some of the big firms that deliver Nexus letters arrange for you to get a letter from a healthcare professional who's contracted with them and just sign off on a cookie cutter letter. I don't believe in cookie cutter or one-size-fits-all letters. I use the records you send me along with over 18 years of treating musculoskeletal injuries in my practice and a library of scientific research to persuasively argue that the injury was more likely than not, or at least as likely as not, to have been caused by your military service. Our personalized service, quick turnaround, and unmatched orthopedic experience can give you the best chance of succeeding in your claim. My assistant will work with you to get your records, and then she'll guide you through the process of scheduling the letter or the DBQ exam. One advantage of working with me is that my team and I are very fast. We can generally get the Nexus letter or completed DBQ back to you within 7 to 14 days of receiving your records and payment. In the description below, there's a link to my website and a landing page in which I discuss the process. You can follow the steps to contact us, get us your service or medical records, and start the process for a Nexus letter or DBQ. My amazing assistant will reach out to you to help with anything you might need. Click the link below to get started. I'm so grateful for your service to our country. I really hope we can work together for your disability claim.